to address the underlying comorbidities that made us sick and dying disproportionately. And so we picked diabetes prevention first, because we wanted something non-clinical, because we're not a clinical group. We have partnerships with those who are, but those who are pre-diabetic, we felt that we could begin to tie in the effects of the COVID-19 experience that we've all been through with that particular comorbidity. And research shows even now that there is evidence that having had COVID increases the risk of diabetes, which we can't afford in our community. So, diabetes prevention is our first step to linking those things to underlying comorbidities. Heart health is absolutely another one. Maternal health is another one. And this conversation about how it affects all of us, psychologically, mentally, emotionally, is present and critical no matter what. And we love addressing this because we like to take on the things that are tough and the things that are things that a lot of people may still find have some stigma to them, right? And so we're just happy to have this many people who want to have the conversation about our mental health. So yes, if you have ideas, that goes for any of you all, that with ElevateHER, you have ideas about things that are on your mind that affect the health and the well-being of the Black community. And we mean Black in terms of the diaspora. If you identify as having roots on the continent, we count you in the number. Send them to us, because we want to be relevant to folks the way you feel and we feel makes the biggest difference. So if you got webinar topics, questions, just bring it, because we're very much interested in that. And I know I've been talking, I'm the facilitator, but I'm not running this show. I got folks who are running the show. So I'm gonna be quiet and let Ms. Dawson and Ms. Dawson come on in and get us started in a few minutes. But please do make yourselves comfortable. Open up your chat, get your mouse ready, because this is an interactive conversation. All right.
Well, good evening, everyone. We're so glad that you can make it. We have some really interesting panelists that you guys can talk to. And we even have a high school student that you can also hear from her experience. And before we get started, just a couple reminders. We are doing a giveaway. So if you would like to enter, follow 3 out of the 5 social media accounts, and then email evidence by taking a screenshot that you followed us, and then just send it to the email that I put in the chat. And we'll give you a gift card if you are selected as the winner. Another thing, we will also appreciate if you could fill out your pre-event survey. So I'm gonna give you guys 2 minutes just to do that before we get started.
So again, welcome everyone. My name is Valarie Davis. I'm one of the founders of ElevateHER, the principal founder. And please do open up your chat window. If you are able to, there is a link for the pre-event survey. And all it does is ask you a few questions so that we can figure out if we're making a difference. You'll get a post-event survey, not later, but at the end of this webinar, so we can see if we're actually doing what we intend to do, which is to engage and educate and inform. So please just take a few minutes to do that.
Okay, again, you guys can just scan your screen right here at the QR code. If you want to make it a little bit easier, it'll take you to a Linktree link where you can follow the accounts. It's all listed for you guys. Next slide. So I am your co-producer for this webinar. My name is Brianna Dawson. I'm a content creator, a Zoom instructor. I actually just finished teaching a class before I came here. So, I'm all about the health right now. I'm pumped. I'm a community health major at George Mason University, also an accelerated master's for public health, and I work for ElevateHER as a community health worker. And Ashley Dawson will also introduce herself.
Hi, everyone. So I'm the twin sister. I'm going to be behind the scenes just helping her out today. I'm actually the funding and development specialist for ElevateHER. I'm also in the accelerated master's program, dance studio owner. You're getting the vibe of the twin thing. But I look forward to getting to know you all, and let's all join together in this community conversation.
Next slide. Okay, so reminder, this webinar is being recorded. We're also on YouTube Live. So if you guys would like to rewatch this, we will leave the link on our YouTube channel, which again, you can access from our Linktree link. Then also remember to be muted until we open it up for questions, just so there's no interruptions. We can get everything that the speakers are telling us tonight. And you can also see the names of our speakers. We have Lisa Gordon, Dr. Lisa Gordon. We have Grace, who's actually a high school student. And then we have Monroe Howard. Next slide. So now I'm going to pass it over to Ms. Valarie Davis.
Welcome, welcome, welcome everyone to this conversation. Again, my name is Valarie Davis, and 3 fun facts about me you see on the screen is that I am currently teaching a dance class for boys and girls. I teach it on Thursday evenings, which might not be impressive to you, but given the fact that I am 50 years old, I am very happy that I can move with 8, 9, 10, 11, 12-year-olds and teach them something. I also have a goal of visiting every single country in the world, and I'm way behind schedule. So anybody got hooked up for travel once we get past this COVID foolishness, let a sister know. And I was born in the Bronx in New York City. So I consider New York my birthplace, but the DC area my home. And I describe myself as a public health Blacktivist because I am all about the business of getting my 2.9 back. If you don't know what 2.9 is, 2.9 years is the amount of life expectancy that Black people lost since 2019. So when we get to the end, you're going to see a place where you can go pick up some swag like what I'm wearing, woo, the ElevateHER t-shirt. But soon there's going to be one that says, I want my 2.9 back. And to be an unapologetic Blacktivist is to say that while we can help all boats rise, I'm unapologetically trying to get our 2.9 back and to elevate and to expand and to preserve the life of Black folks, not at the expense of others, not because we're more important, just because it's important. So welcome to the conversation, and I'm glad to be facilitating. So I am not going to belabor this evening. The next slide just shows you the fact that really grounds me in the need for this conversation. Suicide is the second leading cause of death among Black children ages 10 to 19. I'm going to say that again. Suicide is the second leading cause of death among Black children ages 10 to 19. So I'm going to tell you a quick story, and then I'll let the speakers who are the experts speak. There's a girl, she was in high school, and she was a straight A student, an officer in her class, she was a choir leader in her school choir. She's a church-going girl, had a lot of support, 2-parent home. She had everything she needed in terms of food and water and big family and all of that. And cheerleader, very popular, all that kind of stuff. And one day this little girl had an argument with her mom. And because she was raised in the church, she was raised to believe that you need to honor your parents unequivocally. And this had been going on as a teenager. And in her little teenage mind, she decided that she didn't deserve to live because she couldn't get along with her mom. So she went into the bathroom and she drank a bottle of iodine. And she thought that that would solve the problem because she didn't deserve to live. Now, luckily, she survived because she went to a friend's house to say goodbye. And when she started to get sick, that friend's mom was a doctor. She figured it out. She took it to the hospital. She, expelled the iodine from her system, and she went home. And her family never talked about it, ever. It was just not something you talked about. So that little girl was me. That's my story. So I'm not here to talk academically or hypothetically or in any other sense, but with the real. I understand how it is to be a teenager and in a place that seems so dark that there's no light. And what I want to do in this conversation is figure out how we can bring more light and hope and possibility to teenagers, to teenagers, to preteens, how we as the people who shepherd and grow their lives with them can understand and to begin to separate the stigma of being crazy or ill or off, and just deal with the fact that we are going through some terrible times. And those of us who made these times as adults really have no idea what it is to go through it as a child, with no control, no vote, no money, nowhere to go. So I am grounded in this statistic because I could have been one of them, but I'm here. So with that, I'm going to let Brianna facilitate us through into the next conversation with our first speaker.
So again, hello everyone, if you just came in. So we do have a little bit of technical difficulties. So we're going to actually put our poll questions in the chat for you guys. And just feel free to put a response A and B. They're going to be listed like that. Ashley will be putting the first question in the chat. The first question is, do you know a young person who is struggling with depression, anxiety, or suicidal thoughts? Yes, no, not sure. And Ashley's going to drop that in the chat for you guys.
Can you repeat the question one more time?
So the first general question that we want to ask everyone is, do you know a young person who is struggling with depression, anxiety, or suicidal thoughts? Yes, no, or not sure. The next question that we wanted to hear from everyone to get a little bit of responses are, do you know what to do or say when a young person tells you they are thinking of harming themselves? Yes, no, or not sure. And this is just to help us to be able to send out information after the webinar. And then I have one more question for you guys before I pass it off to our first speaker. And this is a true or false question. Black teenagers are more likely to attempt suicide than their white counterparts. True or false? Again, the question is true or false. Black teenagers are more likely to attempt suicide than their white counterparts. All right, can we go to the next slide, please? And we're going to hand it off to our first speaker, Dr. Lisa Gordon.
Hello and good evening to everyone, and thank you for joining us, and thank you for inviting me to be a part of this webinar. I've been looking forward to it. Let's see, I guess we start out with the fun facts since that's what's on the screen. Yeah, so I have known that I've wanted to be a psychiatrist since high school. It's weird. My mother somehow or another came across an article about a twin study in schizophrenia, and I was hooked from that point. And I spent most of my medical school experience doing things related to psychiatry. I was back then it was called APA NIMH Minority Fellow. Now it's SAMHSA Minority Fellowship Program. And doing research, and then focusing mostly on cultural disparities and in psychiatry. So that's kind of been where I've been for most of my career. I also love animals, especially sloths. I know, but they're my favorite. And then dogs and cats. I have 2 of each, 2 dogs, 2 cats, no sloths, but you know, maybe one day. And I love to knit, and I'm learning to crochet as well. So those are my 3 fun facts about me. So, you know, getting into what we're talking about tonight, I wasn't focusing so much on suicide, but it does come up as part of what's been happening with the African-American community, in particular our children, especially since COVID and with the impact of COVID on the African-American community. Says, what behavioral health impacts and trends have you noticed in the Black community? during the pandemic. And so I put a few on the screen there. First, that COVID has significantly impacted Black children, in particular Black and Latina children. It has affected them in many, many ways. And, I'll be talking about this a little bit more in detail, although I'm going to try to be as brief as possible. That, African American and Latina and Native Americans are 2 to 5 times more likely to be hospitalized or die of COVID, right? And the interesting thing is that, we didn't hear a lot about the impact of COVID on children when it first began, when the pandemic first began. As a matter of fact, people were saying, oh, children aren't really getting it. But once Delta showed up, it did become a significant issue for children. And now you're hearing a lot more about the impact of COVID on children's health. It's interesting though that, and I'm so happy that you're doing this, because I haven't heard a lot about the impact of COVID on mental health for anybody, especially those in the African American community, especially our children. Certainly children, and COVID has affected children in all kinds of ways. But one thing we do know for sure is that, having financial inequality makes that impact worse. Children have also been affected educationally. The stresses of virtual learning, the negative impact on school readiness, loss of skills, those are all important things that have happened. And then the loss of mental health treatment availability. I know that Mr. Howard is going to probably talk a lot about therapy and other psychological aspects of what's going on with our children. From my perspective as a psychiatrist and an MD, I deal with developing treatment plans, making diagnoses, and doing a lot of treatment with medications. I've had a long career both in inpatient and outpatient psychiatry, mostly inpatient, and I've worked with programs that have treated both adults and children on an inpatient basis. And I think, one of the things that we often don't talk much about is that there is a need for inpatient treatment and residential treatment. And that's particularly true for children who just can't make it in the home with family and get what they need at home in the family, or who are in crisis. And as you talk about what the stage that Ms. Davis set tonight, we're talking about suicide too. Certainly suicide attempts and completed suicides have increased in our African American youth since COVID. And once a child becomes suicidal, that's a crisis. And that's often the time for inpatient treatment. However, because of COVID, a lot of programs have been closed. When COVID first started, we lost a lot of inpatient beds. So there just weren't, beds available. And what that then created was what we've also seen is a significant increase in the emergency room visits for mental health by families bringing their children in for mental health treatment to the emergency rooms. And it has increased by 30% for children between the ages of 12 and 17, and 24% for children between the ages of 5 to 11, and that's since COVID. And that's a huge burden on the emergency departments, because when you have all of these programs who have shuttered their doors or have decreased their bed capacity to meet the requirements for safely providing care during COVID, have lost staff because of COVID, it just trickles down. And so I have seen children sit in the emergency room for weeks. Literally, one young woman, an African-American, not woman, excuse me, a teenager. She was about 12 years old, really needed residential treatment and was in an emergency room at the last time I had checked for 45 days. And these children are in the emergency room, but they're not getting any mental health treatment there. There's no way to do any meaningful mental health treatment in an emergency room. But I have to commend the staff because, you know, they did everything they could for that to keep that young girl as, you know, put together as they could. So, you know, the impacts of COVID have been significant across the board. And please tell me about time because I'm not necessarily paying attention to that.
Brianna will keep you updated in the chat about time. But
okay, all right. Let me
just ask you a question about this thing. So, what about the people who say, you know what? It's just COVID. She'll get over it. It's just COVID. It'll pass. It's just, listen, we're all going through something, and you know they'll be okay. The kids are resilient. How do you know when you've gone past the point?
Yeah, you know, children are resilient, but you know, children. I don't think that we pay enough attention to the fact that children are children. They're learning. They're developing. They're growing. And everything that they experience becomes part of who they are. Okay? And becomes part of how they see the world and becomes part of how they then can respond to and react to the world and everything the world has to throw back at them. And so, you know, I that was a popular thing, you know, back in the day, you know, children should be seen and not heard, right? But the reality is everything that they experience, they take it in. And those young, fragile minds don't always know how to process what they're experiencing. And so, you know, it's easy to say, oh, they'll get over it, they'll be fine, but they may not. And what we don't want to do is wait until your child is, you know, attempting suicide and you're sitting in somebody's emergency room to say, oh, my child needs help. And I mean, I have that conversation, believe it or not, with parents in emergency rooms. Well, you know, she's just faking it, or he's just, you know, not being strong or whatever. It's not a character flaw to have feelings. It's not a character flaw to feel overwhelmed, to be, you know, to have to, you know, take a step back and say, I don't know what to do in this situation.
Thank
and
you.
They haven't learned everything and you know, that many adults have learned. So they really kind of probably don't know. And their brains are not wired to problem solve in the way that adult brains are wired. So yeah, I think there's a lot to be said about really, you know, taking a look at what your children are saying to you, how they're behaving, what they're, you know, going through, and really paying attention to that before you get to a crisis.
And one of the things, as we go to the next slide, that you mentioned about children's lives being reflective of everything they're going through, one statistic to keep in mind is the loss of parental figures. The loss, right. If we disproportionately lost folks to COVID-19, those folks were aunties, uncles, grandmas, grandpas, caregivers, and parents. And the data show that children of racial and ethnic minorities account for 65% of those who lost a primary caregiver. So 65% of the children who lost a primary caregiver in COVID-19 were non-white.
Right.
So
and we know that because we know that COVID has disproportionately affected, you know, the Black and Latina and Native American communities. Right. You know, I mean, that's, you know, part of what I was saying earlier is, you know, the children have, I had it categories, they have had the financial losses, but that's because they've had the parental losses. The parents have, lost partners, they've lost jobs. So the parents are stressed and grieving, then the children are stressed and grieving, and they're feeling the effects of these major, major losses in their lives. It's a loss of social supports. It takes a village, right? It takes a village to raise children. But what happens when, your father dies, your uncle, your grandparents, the important people in your lives are gone, and gone so quickly, and so many of them at one time. They're affected by the challenges, the psychological challenges of, and there's also, one of the things we've also known is that during COVID, there's been an increase in domestic violence, right? They're affected by social isolation when the kids, no longer were in school. Because, I always, tell my, friends and family, school is their life. That's their social life, right? and then you take this major thing away from them, and what, for the distance learning, and I totally understand why we did it, but it had an impact on children. It had a negative impact on school readiness. I mean, there's statistics showing that white students, and also loss of skills. They show that white students were 1 to 3 months behind once they returned back to school, but students of color were 3 to 5 months behind. So, all of this disproportionately affects our community. It really does. So what is going on to the next slide, it says, what's the role of the doctor in mental health? And that's kind of what I had alluded to earlier. Most of what we do is a lot of diagnosis and treatment planning, being leaders of treatment teams, especially in residential and inpatient settings, community mental health and outpatient settings. And then a lot of what we do is working with medications. There's still a lot of stigma around taking psychotropic medications in the African-American community, especially for children. I am wholeheartedly, as a physician, am in favor of using medications when necessary. But when it comes to children, and many of my child psychiatry colleagues, and I'm not a child psychiatrist, but I have a lot of child psychiatry colleagues, and I have treated a lot of children. We don't necessarily think of giving children medications as the first line of treatment. So much of what they're going through is exactly what we've been talking about: family stressors, life stressors, social stressors with their peers. And let us not forget the stress of technology and what that brings into the picture. Most of what's happening on inpatient settings and residential programs is a lot of therapy, group therapy, individual therapy, just a lot of therapy. And then if really, really needed, medication treatment.
Dr. Gordon, can I ask you to go mental health one-on-one for about a minute and say, what is residential? What do you mean by inpatient?
Sure.
What do you mean by outpatient? And what is psychotropic?
Okay, so psychotropic is the word that we use for the medications that we use to treat psychiatric illnesses. So you have your antihypertensive medications, which you use to treat high blood pressure. And then you have psychotropic medications, which are the antidepressants, the mood stabilizers, antipsychotic medications, the stimulants that we use to treat children who have ADHD. So all of those, medications. Inpatient is when someone needs to go into a hospital setting. for treatment, where they actually go into the hospital and they stay there overnight and they receive treatment. And then you have outpatient, which is, you just go to the doctor's office, or in today's world, you get on a screen with the doctor and do telehealth for an outpatient appointment. There's programs in between that. So in between inpatient and outpatient, you have partial hospitalization programs where you're in intensive treatment during the day, say from 8:30 to 4:30 or 8:30 to 5:30, but then you go home at night. Okay, and then you have intensive outpatient programs, or IOP, which is a little less intense. So it's usually 3 days a week, and it's usually 3 to 4 hours a day. And what was the other one that I was supposed to talk about?
Residential.
Oh, residential. So many people don't know that there are mental health-based long-term treatment programs for children and adults, and they're called residential treatment programs. So the person goes and stays at the place where the program is. So they're there 24 hours a day, 7 days a week. But it's not the level of care that would be at a hospital. And it's usually often something that, as far as children are concerned, children who really just cannot make it in the community, but they don't need to be in a hospital. And so there's more freedom, but there's still a lot of therapy, there's school, there's, all of that is for them. And they have monitoring by mental health professionals 24 hours a day.
Thank you.
Yeah. And the other thing that we do as physicians is educating a lot of education for parents and children. And I will say that I'm a strong, proponent for people advocating for themselves, gathering information, asking questions. So if you go to see a psychiatrist and they don't explain what they're saying to you, didn't ask them to. I think we should be, because one of the big pushes in mental health treatment is patient-centered care. And that's really about including our patients in their care, in every aspect of their care. And I feel like the one way we can really do that is to educate our patients. And so, I spend time doing exactly what you just asked me to do, explaining to my patients what the diagnosis is, what the symptoms are, why I think they do or don't need medication, or do or don't need therapy, so on and so forth. Or if maybe they just need some community resources. Educating other healthcare professionals, a lot of what we as physicians do is that, doing seminars, working with other doctors. We educate each other a lot, educating other professionals, social workers, RNs, you name it. And then also, doing things like what we're doing tonight and educating the community at large. In terms of reduction of stigma, again, I think so much of trying to reduce stigma, especially around mental health treatment, around therapy, around medication, is education. Our community has had a tough, road to hoe when it comes to treatment in mental health and in healthcare, period. But especially in the mental health community. So there's a lot of leftover fear and mistrust of physicians, of mental health professionals. And it's sad because, we know from the research that's happened over the years that, what we do works. It really does help people. Therapy is not just going and sitting down and chit-chatting. So, I have people say, well, I can just, talk to my family. No, and I think Mr. Howard can attest that, he's providing a skilled service. It's something you learn how to do. And It's far, far more than just chit-chatting. And I see my third one, it says, what are some mental health wellness tips for parents to help their children cope with today's stressors? And, the first one I said is seek professional evaluation and treatment for yourself and your children. We've got to get to a point where we stop being afraid to ask for help and stop, being afraid that we're not going to get the help that we need, or somebody's going to try to do something that shouldn't be done. There are a lot of really good professionals out there, and we really just want to get people to, the healthiest place that they can be. The second thing is listen to your children with an open mind. This is part of going back to what I was saying earlier. We have to start encouraging our children to talk to us and to share their feelings and experiences and actually listen to them and, take in what they're saying. And provide age-appropriate information about today's social climate, COVID, and your family's response to the effect that COVID has had on your family. Kids are so observant. And we may think that we're hiding stuff from them and to protect them, but they know. And they want to know. They want to be a part of what's going on in the family. They want to understand why mom is crying and dad is yelling and, grandma's sitting in her room and not talking to anybody. They're very sensitive to, affect changes in the family, and it's better, I think, to include them and let them hear that, hey, today mom's sad. And maybe we don't have to, give all the details, but, being able to say that is a good, role model to your children to say, hey, well, today mom's a little sad. I'm a little sad because I'm thinking about, grandma who died from this disease called COVID. And, I'm just not happy, today. And I think that's important. And that will also encourage them to talk to us about what's going on with them. And then, engage with your children around school issues, especially around school issues. Partner with your teachers and the school counselors. And if they're not partnering with you, make them. I can tell you my personal struggle. I have a daughter who has ADHD. And, it took me, a psychiatrist, and one of her teachers to even get the counselor to listen and then get her to do what we needed her to do, which is to develop a 504 plan.
What is ADHD?
ADHD is attention deficit hyperactivity disorder. And, there's a lot of stigma around that, especially around young African-American boys. And I totally understand that. And I see Mr. Howard shaking his head, and maybe he can talk about that. But for children who really, really, really have ADHD, and my daughter's a textbook case of it, they need treatment and they need accommodations in school to thrive.
And there's two questions in the chat. What is a 504 plan? What do you mean?
A 504 plan is an individualized educational plan for children who have a specific behavioral health needs. And it's devised to provide the child accommodations to help them with their learning process. And so once you develop that plan with the counselor, the teachers, and the child is always should always be included in that, then those accommodations are set up for them. So it could be something like, in our case, something as simple as having the child sit at the front of the class, the teacher giving them gentle reminders when they kind of see them getting distracted, getting them things like extra time on an exam, things like that. But here's the interesting thing that a lot of parents don't realize: with the 504 plan, your child has to ask for them. If it's something like, I need extended time on a homework or assignment, or I need extra time on a test, because if they don't ask, they won't give it to them.
Right. My daughter also has a 504 plan, and that's different from an IEP plan.
Right. And I was going to say that the IEP is a much more extensive, actual individualized treatment plan, where it's I don't know. I say it's, one step towards special education, and most special education children have an IEP plan. So it's really for children who have much more severe issues, and it's not so voluntary.
Right. And the IEP plan, which is just an individual education plan, is more for if your child has a condition which literally limits their ability to learn.
Right.
A 504 plan can affect their ability to function and access learning, but not necessarily their ability to learn.
Exactly.
So if my child, for example, one of the accommodations that she had was the ability to have more frequent bathroom breaks because of a physical condition she had. Nothing wrong with her ability to learn. She just needed permission to get up and go at will. But it had to be written in a plan, and it comes from your counselor. So I'm going to put actually links to 504 and IEP in here. These are things that the counselor is in the lead for in a school. And if you feel your child has something interfering with their learning, either environmentally, physically, mentally, go to the counselor and say, is this condition eligible for a 504 plan, which just refers to a regulation number, or an IEP plan, because those are mandated by law and regulation to be available in public and private school settings. So thank you very much. I know there's
I have another chat
comment in here
from Nick. It says, a lot of what I run into here in Wisconsin for those in the Black community is a lack of good insurance. How can we move past state insurance or Medicaid for better coverage at our higher rated mental health inpatient and residential programs?
And that's a heavy sigh. That's where your lobbying groups are going to have to come into play. We need lobbyists who are going to lobby for better mental health insurance for Medicaid and Medicare, but also just better coverage. Mental health finally does now have parity, meaning it gets covered at the same rate and level that other medical needs are. But the problem, the way that it has happened, the problem is Medicaid and Medicare do not pay the professional as much as third-party payers do. And third-party payers don't pay us our rate. Okay. So, and don't get me wrong, I want to be able to provide services, but I also have to be able to live. Since this is my chosen profession. There are some programs that have taken advantage of grants and whatnot through the federal government. I work for one here in Philadelphia. It's called COMHAR, COMHAR, and we only serve Medicare and Medicaid populations. But it's a big undertaking to do that. And it does take some work. So, I would say forming, some grassroots groups around finding ways to lobby our senators and our congressmen and anybody on the healthcare committees, going to the healthcare professional societies like the American Psychiatric Association, American Psychological Association, all of those groups to really push for exactly what you're saying, better insurance, better coverage, better payment of your professionals. Because if we're getting paid better, we're going to be better able to expand our services as well.
Well, thank you, Dr. Lisa and Ms. Bao, for explaining some terms that I know a lot of people in the chat may have not been familiar with. So we've all been educated tonight. We're going to move on to our next speaker. But if you do have any more questions for Dr. Lisa, please put them in the chat and she will answer them in the chat. Next slide. And I'm going to turn it over to Grace.
All right, hello, I'm Grace, and a little thing about me, I'm an 11th grader in high school, and I love art, you know, I love like all types of films, videos, painting, I just like creating things. I love fashion and
Grace, I think that your mic went out for a sec.
like a lot of volunteer opportunities, and I just happened to come across Blossom Inc., and that just like was like the best thing ever that I could like get into. So just gonna get into that. In the next slide. So the Blossom Advisory Council, or like the thing I joined was the Blossom Advisory Council, which is an organization which is very much like about helping girls become who they are and like creating guiding points and helping them and like building support systems for girls who are like maybe struggling to like find their path or like work where they want to go. And like Miss Valarie like has definitely been like a great support system, and like in our communications and everything, like, and just being in like the program with all the other girls who are like very sweet, and it's just like helped me find a community like that actually like helped me have a purpose or like something to do while in quarantine. And like it just like the council like helped me a lot with like finding stability in the time of my life where like I was struggling with a lot of like family stuff, especially with school and like trying to stay focused and all those things like that. So it definitely helped me like keep on track, and like it helped me like set forward my love for volunteering. I didn't know like what I was gonna do with like the volunteer and everything. I just like randomly went on Montgomery County Volunteer Center, and then that's why like after that I just like been volunteering for a lot of things. It just made me like love volunteering even more, and like impacted my love in community service. And I was able to be a part of a thing called the Girl Talk Instagram series, where we would have clips of girls, Bria and I think Nora, who talked about like helping girls in school and staying in school and what that means to us and impacting like school, careers, relationships, and life goals. So get into our questions. How does your program address youth mental health during the pandemic? And I think just like one thing Bria said that I really liked, that I wanted to put a quote in, was like, we have to look beyond doing for ourselves and doing for others and comparing one another. And what I took that as, we need to like stop looking at what everyone else is doing, especially in this time where everyone, like it was very hectic and like no one knew what was going on and what to do. We need to come into ourselves and figure out what we needed to do for ourselves and what we needed to do to get back on our feet and like sustain ourselves. And since all of us was very quarantined, we were like trying to figure out this whole thing. And we really, one of the main things that like helped, especially for my mental health or whatever, was like the connection we built through this program. And we talked about how it impacted our daily lives, financially and physically and everything like that, especially focusing on our education, which was like a struggle for a lot of people. And we just asked ourselves, like, how can girls come and like reconnect, and how can we get girls who might be thinking about, you know, school might be not that worth it, to like find their direct goals and how to get back to being on the path of like high school, and then what do we need to get out of there, mentors, anything like that we needed. And I think we also did that in like many unsaid ways. Just like finding activities that girls would like, finding a community. Like I feel like community building is very important. Just getting people familiar with what like all the resources they need, and like having a safe space, and like feeling comfortable with people that you know you can talk to anytime or like have fun with. I think that was also really important. I love how like we had meetings just checking on each other, and even the packages that were sent out were very meaningful. So just like it gave me a sense of community, of like, yeah, this is what I want to do. This is where like I feel like I belong. Okay, and then how do you believe the pandemic affected Black girls differently? I think that it affected us in many ways, especially for me and like friends that I know. There's a lot of, especially for like high school girls who are like grown, there's a lot of expectation in like your home and like household responsibilities and chores and all the things you have to do. When you have little siblings, you like tend being like the mother while the parents are like out on work, so you tend to like care for your younger siblings and make sure everything is going correct. So you're kind of like the second adult in the household, and you're trying to keep everything together. And I just think that, well, for me, I can share my personal experience. For me, like the pandemic made me grow in ways that also made me, I think, like lowered me in ways. So that's like the same way I think the pandemic affected each one of us differently. For me, it was always, I was always like focused on grades, and had a lot of anxiety in school and like stress and all this stuff working in school, and like trying to be perfect and trying to be this and that for school, and like just struggling with a lot of mental stuff. But then when quarantine came, or like the pandemic came, it just gave me like some time to like kind of sit myself down, and I realized like all the stuff that I was like struggling with, I had time to like really focus in on what I wanted to do with my future, especially, and what I wanted to do with school, because I kind of wasn't like doing anything for myself. I was just focused on perfection, or trying to be like, do something for the household, trying to like make money for the household, and just like anything that could get me somewhere. But I actually had the time to like sit down and with myself and like focus on what I wanted to do, and actually gave me like a sense of direction, basically. And then also affecting Black girls in a way on social media, the presence of like Black women, the whole thing with Breonna Taylor, and like the images of like Black women, or you're expected to be the strong Black woman, and that Black girls never get the chance to like cry or like sit down and talk about their struggles, because every time they do that, then it's like something else pertaining to other things, especially like with self-image and like being a dark-skinned Black woman. It's really hard to like find a space where you can like be comfortable in sharing that vulnerability inside of you, because there's always like expectation. Oh, you're supposed to be strong, you're supposed to be this, you're supposed to be that. So I think like that pressure on Black women, Black girls, especially in like BLM, because I know a lot of my friends, when the BLM movement started going around, they wanted to go out, they wanted to like protest and all that stuff, and it was like a lot. And then there came the whole misconceptions of like, oh, Black women shouldn't be protesting, they shouldn't be doing this or that. So that was all. But I think quarantine helped me find a lot of good communities. I found really good communities discussing things like that. One was on Instagram, they're called Darkest Hue.
We lost you, Grace. I think your mic is out. You were talking about Darkest Hue. Can't hear you, Grace.
What's going on in life.
Grace,
And
this is Miss Val. Can you go back and explain what darkest hue is again?
oh, okay, so Darkest Hue is this platform on Instagram, which is basically a safe space for Black women to share any experiences they go through. The main topic that like is mostly expressed through is colorism. They get a chance to like just share their experiences and connect with people and all that stuff. So I definitely worked with them and like got to express my experience basically on Darkest Hue. It's on their page. So I think that is like really good for like addressing stuff like stigma and all that stuff. And then question 3, what are mental health challenges that Black youth are facing now and how are they coping? So we know that I researched the suicide rate among Black youth has doubled since 2014 and is now twice the statewide average. And just knowing that like we are at more risk of depression, anxiety, and stress, and just with all the spotlight on police violence and financial struggles that each individually are going through and all that thing, it's hard not to see Black people with a lot of anxiety and grief from COVID, especially with the demographics and the media coverage of our Black youth. It also goes into playing like the stigmatizing stereotype that everyone has to be strong, which I feel like unintentionally that goes into our Black youth, especially our young men. A lot of like our teenagers or friends of mine, they rarely ever talk about like anything that they're struggling with or like anxiety, pain, even though like you can see it. It's like they'd rather just wave it off instead of actually talking about it, especially with counselors. Even if people try to get them, they struggle with that. And I think that that is a really big struggle in our community. And I feel like coping with it and like helping it, just need to like find a community, find people you can talk to, even if it's friends, even if it's parents. I know for me, it was really hard when like before quarantine, talking to my parents about like how I was feeling mentally, how I was feeling physically and everything like that. But I feel like once everything happened, my parents became more like aware of certain things and they just started asking me more questions. How was your day going? What's going on at school? Like asking me questions about how I'm feeling, even if they have to like sit me down physically because I don't like talking sometimes. You know, it's just like you have to put yourself out there, and it really helps just talking, even if just talking to anyone. Honestly, it just helps talking, and even if it's to a religious leader or anyone. And like we have the most strength and support, I feel like, from our friends and community on TikTok, any platforms that you have, that sense of community and like being able to relate to your peers. I think that really helps. And know that for me, like keeping up with school and having outside like a job, taking care of family and stuff like that, it was a real struggle. And it's hard not to feel despair, especially with everything going on. You feel like, especially in schools, it can be hard to talk to counselors. It can be hard. It's even like now hard for me to even like contact my counselor sometimes. So I know how it feels like no one's listening to you, but it really helps when you just like find that one person to really relate to and to talk to. And I feel like kids are doing that more on the internet, just finding like an internet community that helps you, somewhere you can like find, like I found Blossom Inc. on the internet. You know, it's just like, just you have to like put yourself out there and like be like, how can I help myself at this point? Or like, how can we help each other? Even ask your friends to like, oh, hey, do you know any places I could find a good community to talk about some things? Even if you can't talk to anyone in person, I'm pretty sure there's a lot of people out there that want to know about your story and want to know how they can help you.
Thank you so much, Grace. It was nice to hear from you. If anybody has a question from our Black youth voice tonight. You feel free to put that in the chat. We are going to move on to our next speaker just because we're running short on time. But thank you so much, Grace. It was really nice to hear from you.
Let me just jump in for 1 second and say something about Grace and what she represents. Very often in the pandemic, when it comes to people telling us what's going to happen and what we should do and how things are affecting our community, the grown-ups who created this world that is jacked up center our own voices. And our purpose tonight was to put Grace in the center of this conversation and really have you all hear in the voice of someone who is young what she's experiencing. And some of people like Monroe, who you're getting ready to hear from, he gets to hear from youth all the time because that's his job. But a lot of us aren't forced to or even privy to the opportunity to sit and just listen and absorb in their own words what our children are thinking. So please, just really let this sink in. And I honor you, Grace, because it takes courage to get on here with a bunch of grown-ups, with a bunch of alphabets behind our names, and really be vulnerable and share. So I give you snaps. Everybody gives you snaps and claps. Y'all can come off there and on the camera and give Grace some dap, because she's a girl who's standing up for all the youth in this moment. So thank you. Monroe.
Good evening, everyone. My name is Monroe Howard-Shackelford. Let me just start by saying how honored I am to be amongst this distinguished panel. Dr. Gordon, Grace, I am so honored to be here. Thank you for setting the stage and the context for what is happening. Grace, thank you for sharing from your heart. Very much heartfelt, and I appreciate it. And like Ms. Valarie said, yes, that is what I do day in and day out. I work with both adolescents and adults in the private practice that I work with. So I do have the privilege and sometimes that challenge of having to hear some extremely devastating stories from our young people who have experienced so many things at such a young age. But I definitely have the privilege of doing this work and partnering with them on their healing journey. So quick fun facts about me. I'm going to start my little timer here. I have 5 names. They're all mine. They're all on my birth certificate. Monroe, Aaron Devon, Howard-Shackelford. So that's legit. I have jumped out of a plane twice, once on my 30th birthday and then once actually 2 months ago on a trip overseas. And then the last one is I have visited 23 countries so far. So like Ms. Valarie, I do also have that goal of visiting. I don't know if I'm going to get to all of them, but I'd like to visit as many as I can. So we'll pass each other in the airway somewhere. So those are a few fun facts about me. Kind of diving in. A lot of what has already been stated is some of the things that I was going to highlight in my presentation, but I think it's a wonderful illustration of how, again, there's this cohesion in thought and a lot of what we are thinking in terms of how we're analyzing what's happening here today. But what are the signs of major depressive disorder in today's Black youth? So I want to say that there are other depressive disorders, but in terms of the major depressive disorder, it is of the most severe condition of the disorders. And one of the features of it is that most teens, they may have symptoms that last for at least 2 weeks. In terms of the diagnosis, and I am not a psychiatrist, so I do not prescribe medicine. My profession is in talk therapy. So I provide that portion of the treatment plan that Dr. Gordon was referring to and where we all work together. So I am not as well versed in the medication in terms of that. But and in the diagnosis, if we're seeing someone who is exhibiting signs, which I've listed here, symptoms, 5 or more in the category, then for an extended period of time, then you may see that person as someone who is experiencing major depressive disorder, or there may be a diagnosis in that manner. This is not an exhaustive list, okay? But some of the things that we see here may be common to an experience. And if we have a young person, if we have a parent, a caretaker, or a caring adult that is in proximity to young people, you may have seen some of these things, right? Academic decline, withdrawal from family and friends. I want to pause here and talk about the withdrawal from family and friends also as where you might see what we're saying moody or irritable, like, oh my God, they always have an attitude, like they don't want it, you know. And so some of these things sometimes can be to people an annoyance, but it actually can be a sign and a symptom that there is something happening with that young person. So in my later slides, I'll talk a little bit about what parents can do. And one of those things is to not ignore the signs and to be curious, but I've alluded to what I'll talk about a little bit later. Of course, we talked a lot about suicide here. A 2018 study found that Black children between ages 5 and 12 are about twice as likely to die by suicide as white children the same age. Now, again, I'm just echoing what has already been stated in terms of statistics, but some of the reasons why this may be more prevalent and we're seeing this rise is because there's a such thing as adverse child experiences, right? And there's actually a tool out there to measure kind of basically what young people may have had to encounter, maybe even before the age of 10 or before the age of 12. And I have done this when I worked in K-12 education, and it is alarming. It is alarming to see the number, when the ACEs score, or the number of adverse child experiences that many of our young people have experienced at early ages and yet are still showing up every single day, right? But they are carrying these things. And so if we talk about them not being diagnosed or them not being able to have access to treatment, then these are things that they are trying to manage or deal with on their own, as to where we might then start to see some of these symptoms. There may be problems sleeping, loss of interest in once enjoyable activities, anxiety, loss of appetite or weight. And then I also wanted to bring up something that a lot of times gets noticed in our communities, our Black and Brown communities, especially in our under-resourced communities, is that there's actual reporting of physical pain in young people. Physical pain that gets reported, and oftentimes, again, I know some people have talked about it, may get dismissed or ignored, or maybe saying you're faking it because you don't want to go to school or you don't want to do this activity. And I know for a fact in the work that I'm doing, there are several of my adolescent clients who have reported feeling this chronic pain that, again, when we talk about some of the other situations that may surround that and some of these other symptoms that are going along with that or occurring along with that, right? This can be a sign of them experiencing a depressive episode, or again, this ongoing or persistent depression. I want to say this too right here. When we are really thinking about these symptoms that I've listed here, I also want us to be aware that there is situational circumstances that may cause someone to be depressed. I think we don't normalize the fact that if you've lost a loved one, if you've lost a certain relationship, for young people, if maybe you've not met a certain goal or expectation in school or in sports or in some other type of competition, you may feel down, right? So we also want to be able to normalize the fact that we do experience a range of emotions. And I think that's also part of the education, so that we can make some differentiation between when a young person is experiencing something that may be caused by something that happened or a normal kind of life occurrence, and when this is persistent and may need further treatment or care. Next slide, please. So I love this question because it says, how can parents and bystanders assist a child showing signs of major distress? I wanted to kind of like bullet this with some underlines. So if you went away from this presentation and you didn't remember anything, you might remember some of these underlined bolds. So for parents and bystanders, validate, right? Try not to minimize or dismiss your child's experience. Again, this is something that has already been stated in the presentation, but again, I want to echo it, how important it is, especially as we are helping our young people develop their emotional vocabulary to be able to express different feelings or different emotions other than, happy or angry. This is an opportunity to hear them out. Let them be able to have the space and opportunity to explain to you what's happening to them, and then try not to minimize or dismiss it, especially because of their age. Sometimes we may dismiss young people because we feel as adults that they haven't experienced enough life to have any type of depressive, symptoms or episodes, and that's just not true. Our young people are experiencing life as we are. And again, as Dr. Gordon stated, they are still developing, right, their minds and their emotions. And so therefore, they may not have all of the coping skills to be able to manage it in the way an adult has, right? So it can be actually more devastating by that fact. Be curious. Avoid making assumptions or jumping to conclusions. This is a wonderful way to stay engaged with what your child is doing. What are the things that are affecting them on a day-to-day basis? Asking questions, listening more, and listening for understanding versus listening to respond. I know that may be hard from some of our parents because, listen, you're tired too. Listen, you got your own things you are worried about, and you are maybe trying to manage a household and keep food on the table and keep lights on. But this curiosity with your child can go a long way because as you develop that open line of communication, it really can be the first line of defense for a young person who is in distress. Reassure. Remind them that we all face challenges and that there is no shame in needing help. Again, helping to remove the stigma that we become overwhelmed at times, that things happen in life that we don't have control over, but it still may elicit certain strong emotions in us. So to reassure them that those emotions, once again, are valid and can be their truth and their lived experience, again, will help go a long way. And the thing about it, I all capped all, because it's a great way also for you to be able to relate with your young person in that communication, which help further develops that relationship and strengthens that relationship. Empower. Try not to force outcomes onto them. Let them know that they can make decisions about their mental health, especially in our adolescence. Letting our adolescents be a part of, as we talked about in the, in those 504 plans, being a part of the solution, being a part of the brainstorming or the collaboration is a great way to empower them. Because here's the thing that I teach when I am working with my clients is that we're actually building the capacity for them to have to hopefully not come see me after a while, right? So that we might be able to navigate some of those strong emotions that will arise as a result of, again, the life that we are living. And so empowering them to be able to make those decisions and to, number two, seek those supports. So as a parent or a bystander, please assess the supports that may exist in your community, whether that's in your school community. I come from a church in Harlem that actually offers free counseling for the Harlem community. And so it's a great intersection of faith and mental health, right? I work on a grant here in Montgomery County where we are offering free therapy services to Black residents of Montgomery County. It's the reason why I'm here today, right? And so I'm really do encourage us to be able to know what some of the supports are out there. Again, the school counselors, licensed therapists, and also the support groups are really helpful in really moving towards that solution. I like this last one, and I included it because avoid blame. Really helping to keep the focus on getting them the help that they need and they deserve. Now, I put this one in here too, because I know that at times you as the parent might begin to absorb the blame, or might begin to spend a lot of time and maybe even centering what is happening to your child around you versus keeping the focus on what that child may need in that moment to really get that help and that care. Keeping that central focus on what they need and deserve is also going to be an avenue to uncover some of those stressors or triggers that may exist in the family dynamic, that may exist in the school community, that may exist in the social fabric or the social community. So again, I really want to have us to try to avoid the blame and really keep it focused in on those young people. We'll go to slide 3.
As you go to slide 3, so here I am sitting, listening to you, and I say, listen, Monroe, I don't have anything left. I'm feeling all those things. I can check 5 out of those 10 boxes. I can't get myself together to go figure what she needs because I'm not together. So how does a community that is already traumatized, depleted, etc., go do any of this stuff? What do you do? And when you go to your village is depleted.
Yeah.
What do you do with that?
Yeah, and I think that is, thank you for bringing that up, because again, that's why I was saying in terms of like having that relatability or that resonance with your child to let them know that, mom, dad, granny, I don't have all the answers, right? So it's really kind of like breaking down that barrier, because one of the reasons why I find that young people don't even feel comfortable in talking to their parents, because they feel like they will be judged, because there is sometimes this projection of perfection from the parents, right? Or there's, even if they see their parents struggling mentally, and again, as Dr. Gordon stated, children are very aware of what is happening, but there's not a certain level of transparency in the home around what some of the challenges or struggles are, then young people, again, do not feel as comfortable in relinquishing information about some of their challenges or struggles. So I would say, in terms of like, to your direct question, being honest with that young person and saying, I'm experiencing some of those same things too. Here's the way in which we might be able to support each other, right? And it opens up a beautiful, vulnerable conversation between that parent and that child about ways in which you might be able to support each other. And again, that's why I'm also saying, seek the supports of your community. If there's a house of worship, if there's, again, these community organizations that can provide certain services, the removing that stigma of receiving services that may even be free is also something that we may have to overcome in order to get the support and the help that we need as a household.
Yeah, and so that's not a Black thing, right? I'm just going to say it. Like, Black parents are not going to get down on the level with our children automatically, certainly those of us of a certain age, and share vulnerability. That's like a cultural no-no. Grown folks' business is grown folks' business, children's business is children's, even my struggles. So when you're saying that, it is work. And we also we might do it imperfectly.
Absolutely.
Right? Or we might start and be like, no, I ain't doing that no more.
Yeah. Absolutely.
Or we risk their thinking, like we fall off a pedestal with them. Like oh my goodness, they'll think that I don't know anything about anything. So it's a complicated cultural moment as well. So question 3, let's keep moving.
Absolutely. What advice would you give today's Black youth to cope with current crises? And does this advice differ for boys versus girls or by age? One of the first things that I would say is please avoid isolating yourself, right? Isolation definitely is one of those tools of the enemy to tell you that you're all wrong, that no one loves you, that, right? And this is what a lot of the work that I do in our therapy is really identifying these false narratives or these inaccurate narratives that do not actually paint the picture and can cause some of this cognitive distortion that tells you that you are not worthy, that tells you that you are not loved, you're not cared for, right? And a lot of that can happen in isolation. Talking to a trusted adult, it pained my heart when working in the California public schools, which I did for almost 15 years, that we would do this California Healthy Kids Survey every year. And the statistic of kids being able to identify one caring adult on that school campus that they felt comfortable in talking to, it was always so low. And it just really spoke to the work that we still need to do as adults to really be able to foster those relationships so that kids and adolescents do feel comfortable in coming to young people, and coming to adults when they are having some struggles. I know Grace said it's even sometimes access. It's even hard to get in touch with a caring adult for certain reasons. So those are some barriers in which, systemically we need to work on. Try not to dismiss your feelings. And again, this can be a learned activity for a lot of the reasons that even Grace brought up in terms of gender norms. So I wanted to bring this up too, in terms of a lot of times it gets reported in teen girls and occurrences of depression that it's a lot of times twice as likely that a young woman will have, these depressive symptoms over a young man. But for me, I believe that it's underreported for boys because of the gender norms and the way in which we assign feelings and emotions to a gender versus understanding that experience as a human experience. I deal with it all the time where I've had clients who did not want to have conversations with their parents, particularly their fathers, because they didn't want to be perceived as soft, which then also was associated with sexuality, right? And so because of the stigma around sexuality and because of the gender norms, this was preventing conversation from happening. And therefore it would allow this individual to repress a lot of the feelings that they were having, or that they would have to get over it. Be strong. Be aware of people or situations that trigger negative emotions. This includes social media. Right? And this goes for adults too. We have to filter our intake at times, but definitely be aware of the situations and the people that cause you distress, or when you may feel those negative emotions coming on as a result of being in their presence or that interaction. Here, avoid experimenting with alcohol and drugs and other potentially harmful substances or behaviors. I said behaviors too, because I also want to put in here in terms of individuals that may be engaging in sexual practices that one may not be developmentally ready for, and inappropriate in terms of with different partners, dangerous, so on and so forth. So it's important that we recognize too, and I want to say this, some people will say that, well, the alcohol is, what is depressing them. But I also want us to know that sometimes that self-medicating is as a result, or the need for the self-medication is as a result of what they may be experiencing in a depressive episode. So that is very important also to make sure that we're understanding that relationship between alcohol, drugs, and other potentially harmful substances. Remember that your friends may not always have the best advice, right? It is very important that you develop healthy relationships with your friends, and that social interaction is a part of your development and your growth, and what helps us really kind of understand who we are in society. And that is going to, develop over time, but also understand that your friends are also on that developmental journey along with you. So for a lot of things, they may not always have the best advice, but I encourage you to talk to them and seek supports together if necessary. Be a support network for each other, right? And then lastly, I'll say find outlets to express your emotions. A lot of the work I do is really just helping young people channel these very strong emotions, whether it be through writing, journaling, art, or physical activities and fitness. I'm going to say this too for our parents who may be listening, is that these outlets can be a lifesaver for young people being able to express these strong emotions in very constructive ways. And these are the ways in which we want to encourage them to be able to navigate the challenges that they may be experiencing as a result of, again, some certain traumas or certain things that may be happening at school or in the home life. That's it for me. I was trying to stay on time, but thank you very much for having me here today.
You are on time. You are on time. So before we jump into the ending piece, I just wanted to make note that if you don't know and you want to save what's in the chat, if you open up your chat box and look at the bottom right corner of your chat box, there'll be 3 little dots. Now, if you're on a phone or a tablet, you might not see it. If you click on those 3 little dots, you can save what's in the chat to your hard drive. It'll be in the documents folder under a folder called Zoom with today's date, and you can save the chat if you'd like to. So
okay, thank you
Brianna,
guys.
what's next?
Thank you guys so much. If you have a question for Mr. Monroe, please put it in the chat and he can try to answer that, or we can email him the question because we are running low on time. But just a couple of reminders that if you are enjoying our webinars, please support us so that we can continue doing this. So you can buy some ElevateHER swag. And that link is again on the link tree. So everything is there for you. And we have sweatshirts and t-shirts and long sleeves. So we have a few you can choose from, different colors as well. Next slide. And we're going to put it in the chat again, but please fill out our post-event survey just to see if anything changed in your responses after watching this program. Also, feel free to stay up to date with our mobile app. So that's also on our link tree as well, where you can actually get updates sent to your phone. So we do have social media platforms, but you have to actually log in for that. While this mobile app is going to send a notification for you to open the app and see what we have posted recently. And then also you can see all of our social media accounts. So there's various ones. If you're not on one, you might be on the other. So feel free to stay connected with us. We would love to follow you back and just keep doing what we're doing. Next slide. So that's it, but we do have time for like maybe 2 questions if somebody feels free to unmic. And if not, I do have some review for you guys from the poll questions if no one has a question. So feel free to unmute if you do have a question for one of our panelists.
Yes, people. Okay, this is a Black thing. This is the part in the church where if you don't respond, then people start calling names. My father was a preacher. So Linda, Michelle, Natalie, Patrice, Sephora, Maylise, Nikki. Nick, you've been in the chat, but you're welcome to come on in. Randy, say something. How was this? I see you in the chat. I know everybody's not necessarily camera ready this time in the evening, but we want you to feel free to share, ask questions, whatever you got. This is the time for that. And we do have time for that. This is a safe space. So I'm seeing stuff in the chat. Thank you. Thank you. Thank you.
Hey, Val, this is Nick. I'll be happy to pop in there.
Go on there. So Nick.
So I certainly appreciated what Monroe had to say. He's like a brother close to my heart. I'm actually in my LPC program as well right now, and I actually heard about this online event as part of my multicultural class that I'm in right now, and as I'm expanding my field of those that are in underserved communities, I'm so glad that I was able to come on tonight and just really gain some stuff that can help me with my future clients. And Monroe, you're right there, brother.
Thank you so much, Nick. Anybody else have a question or comment you'd like to add?
Hello. Sorry that you can't really see me. My lighting is terrible. That's why I've been like,
it's okay,
not showing myself. But I thoroughly enjoyed this because I got a lot out of what young people could be experiencing these days. And I kind of wonder, I had been hearing about the high incidence of suicide, and it really started to concern me. And I wanted to know what do I look for? But I did get the opportunity to get a little taste of that when I talked to a 14-year-old yesterday. And what she talked about in front of her mother, some things that her mother didn't even know that she was going through. And so it really got to me that could I also be so blind about what our young people are going through when, it's difficult enough for the adults to be going through something. Like, I don't have young children in my life right now. My children are adults, but we have gone through some things that was a challenge. So if I'm feeling it, what are they feeling? And the parents who have to, who are raising them, I really appreciate this webinar, because I've learned I don't want to be detached and not step in to do something, even if I have to make the parents aware of what their children are telling me, and encouraging the young people too. While, it's tough. It's tough. I have never gone through what they're experiencing, and, up until my age, and I'm 62.
Thank you. Yes, Linda. Amen to all of that. Thank you for being here.
Thank you.
So just for a quick wrap up, just some of the topics that our panelists did get over. We have another question of, what are some education impacts on today's youth due to the pandemic? So the responses are stress from virtual learning, not enough homework, loss of skills, or both stress from virtual learning and loss of skills. So that question is, what are some education impacts on today's youth due to the pandemic? And this was a topic brought up by Dr. Lisa, to jog your memory a little bit.
Yeah, we I didn't talk about it at length, but the biggest thing has been the loss of skills and the lack of school readiness for younger children. So, children who are coming into kindergarten, first grade, second grade, are not ready for the environment. They're not ready for the social expectations, interacting with others. They're not ready for the learning expectations, the problem solving, all of that. It's been a real issue. And then, of course, the loss of skills. A lot of kids, when they went into the distance learning, being at home, just were not able to remain engaged. And they had great difficulty with concentration, great difficulty with memory, great difficulty with learning the skills that they need, especially, i.e., learning how to study. Things of that sort. And I think we just maybe didn't realize how much we were losing, when this happened. It's unfortunate. It really has been unfortunate. Mm-hmm. Luckily, children can bounce back, but it takes some effort. And I have a lot of friends who are teachers, and I hear it from them all the time, how difficult it is, when they have to work with these children who have lost so many skills over time.
Let me just make 3 quick closing comments as Brianna closes us out and lets you go. Number 1, I want to say, if you're in Montgomery County Public Schools just announced an $8 million investment in putting mental health and wellness centers in every high school. So if you have a high school student, I want you to call your school tomorrow and ask them, when is ours coming? How can I be involved in that? Sometimes we don't know what we can do. That's an action item you can take. Just ask, when is it coming? How can I help? How can I be involved? That's number 1. Number 2, realize that the teacher shortages that were predictable completely predictable from COVID-19, are going to get worse next year. You are going to see a mass exodus of teachers after this school year. So whatever you thought was bad, short, not enough, too many subs, too many contract teachers, it's going to get worse. So as parents, please spend the summer understanding that with your school. School administrators don't go anywhere in the summertime. Your school turns into a summer school. Ask the questions now about how are we anticipating this? What does this mean for where my child goes to school? And what can I do to support them when teaching gets even harder? The last thing is this: grace. Slather everything for children with a whole bucket full of grace. And for me, with my 14-year-old daughter as a single mom, whose business was destroyed in COVID, April of 2020, building from zero, nothing, $0, zero business, zero contracts, nothing. And she's at the dining room table and I got to supervise instruction. Grace. Grace looks like, I would ask her once a week, is there anything that's too hard this week? We can drop it. Is there any class that's too much this week? You can take it again. Is there any assignment you just cannot do? I'll negotiate with the teacher, because if they live, they can learn another day. If they live. So grace. Nothing has to be done right now except to breathe and to live. So I leave with you with that. I thank you all for being here. Thank you for your support of ElevateHER. You are now in the family. You're going to get emails from us. You're going to get stuff. Get your swag and represent, because we are all here for it, right? Especially for the babies, especially for the babies. So Brianna, close us out. Thank you.
We did have another question in the chat if one of the panelists could answer that real quick, if they have time. And then one other review that I wanted to bring up was brought up by our panelist, Mr. Howard, where he had talked about major depressive disorders and how long that typically lasts in teens. So the answer to that was actually 2 weeks. And then to close out, again, please fill out our post-event survey so that we can see if your answers change from the pre-event and see if there was a difference, if you were paying attention, if you learned anything. Also, remember, if you want to get a gift card and enter into our giveaway, just follow 3 out of the 5 social media accounts. All of that's on a link tree. So it's really easy. You just pull up that one link and then just start following. Take a screenshot and then send it to the email that's listed in the chat. And then we'll select a winner and let you guys know if you won. Thank you guys again so much for coming. We appreciate everyone for coming today, and feel free to share out the live stream link and continue to follow our YouTube channel. We actually have some interviews that Ms. Valarie Davis recently did. If you want to hear more about her, she is our project leader for ElevateHER. And thank you again, everyone, for coming.
Thank you and good night, everyone. Thank you, Michelle. Thank you, Nick. Thank you, Maylise. Thank you, Ms. Tanya. Thank you, Michelle. Thank you, Monroe. Thank you, Dr. Gordon. Nice having you, Randy. Good to see you, Emmanuel, sort of. I see your picture. Galaxy and Sephora, thank you for being with us. We appreciate you. Thank you, Deborah.